Thank you, Chairman Griffin. I want to thank our panel of CEO witnesses for being here today. Today's hearing is the first in a series of hearings focused on healthcare affordability. And we begin by hearing testimony from our nation's top health insurance CEOs. According to CMS, America spent $5.3 trillion on healthcare in 2024. That represents a staggering 18% of our country's gross domestic product. Over 200 million people in the U.S. get their health insurance through the private marketplace. Of that total, around 178 million people receive their coverage through their employer, and 24 million get their coverage through Obamacare. Across these markets, healthcare costs have been increasing at an unprecedented rate. In the Obamacare markets, healthcare premiums increases for 2026 were as high as 40 and 50%. In the employer marketplace, year-over-year cost increases for 2026 are at a 15-year high. Despite what my Democrat friends would have the American people believe, healthcare affordability is far from a one-market issue. It also isn't a new issue. This committee has previously worked in a bipartisan way to pass major reforms across the healthcare sector to make healthcare more affordable for all Americans. I hope we can rise above the politics and have a real discussion about the root causes of affordability and how we can help all Americans have access to more affordable care. And that is why we have convened this panel of CEOs today, who can speak authoritatively on the market forces affecting affordability. The goal of this hearing is to have a conversation about these rising healthcare costs, and your companies sit at the center of our healthcare financing system. Nearly every dollar spent on healthcare in America runs through your companies or one of your competitors. And as we as a country are spending a lot on healthcare, a core component of your industry's value proposition is working on behalf of Americans to lower the cost of healthcare, along with improving access and quality. Yet healthcare costs are increasing every year, and more Americans have become frustrated by the feeling that their insurance isn't working for them and working against their health. I want to be clear in what we expect to hear answers on today. As some of the largest companies in our economy and amongst the companies that benefit the most from government subsidies, how do you justify the continuing skyrocketing costs for your beneficiaries? What are you doing that is working to lower healthcare costs, and what isn't working, and what are the barriers we need to address? What should insurance companies be doing better to live up to the promise to the American people? I thank you all for being here. I look forward to a spirited discussion and great information, and I will yield back.